The East African tradition of the Maasai tribe is to greet one another with the words Kasirian and Gera, which is Swahili for, so how are the children? In that community, the well-being of their children is the highest priority. If you are interested in participating in thought-provoking conversations about the well-being of children and families, please tune in every Wednesday at 3 p.m. to Fresh Start Today on 860 AM WNOV. Together, we can save our children.
Good afternoon. You're listening to Fresh Start Today. Your host today is Jermaine Reed and Sean Roby, and we have in the studio with us a very special guest from Life Striders, Veronica Sosa.
Hello.
Good afternoon, Veronica. How are you doing?
Good. I'm so glad to be here. Thank you so much for having me today.
Certainly. Thank you for fitting us into your schedule. We're going to be talking about a very important topic, which is understanding postpartum depression in teenage mothers. Very important topic, one that you don't really hear a lot about, but we're going to be talking about that. And we also have some community announcements before we get started. You know, the 500 Black Tuxedo event is coming up this weekend, and Brother Andre Lee Ellis is kind of championing that whole initiative. And there's still room, I guess, for some young men to participate, and also some adult men to chaperone. If you want to learn more about that, give Andre Lee Ellis a call at 414-779-2476, 414-779-2426. We have a lot that's coming up in the community and child welfare, a lot of changes, a lot of things going on in the city. But we're going to spend this time today talking about, again, understanding postpartum depression in teenage mothers. And if you want to participate in this conversation, feel free to call 414-444-5250, 414-444-5250. Now, the American Academy of Child and Adolescent Psychiatry reports that teenage pregnancy in the United States is almost a crisis for the youth involved and their families. A teenager who gives birth will suddenly realize that their life has changed. They might experience some challenges in school. They may even have to drop out of school or to be homeschooled or to take on a job or two just to make ends meet. But another thing that's really big for teenagers is their social life, and that the social life could possibly change as a result of having a child. And all of these things, plus the hormonal changes that happen or occurs within women, can also lead this person to experience depression and place teenage mothers at a greater risk of having postpartum depression. So as I mentioned earlier, we have with us Veronica Sosa from Life Striders, and she's the co-founder and the executive director. Hopefully today you'll be able to help us with a couple things. One, Veronica, if you can help us understand what exactly is postpartum depression. If you can talk about some of the other perinatal mood disorders that exist. And then also if you can help identify which populations are at risk of having postpartum depression, if one population at greater risk than another. But we also like to know if you can explore some of the causes and the signs or symptoms and treatment responses for PPD, as some people call it. And then the last thing we want to be sure that we can give our audience is some resources resources to help them if they suspect that they or their child or group home resident is suffering or dealing with postpartum depression. So again, good afternoon, Veronica. How are you?
Good afternoon. I'm so glad that you're talking about this today, that we're going to be talking about this today. So at Life Striders, I'm a psychotherapist, and we also, in addition to doing therapeutic horseback riding, we also do marriage and family counseling, individual counseling, and a lot of family systems work. And one of the things that we also do groups, also with children, adults, and teenagers, and one of the things that we are very careful of when we are working with teens is not only to help support them so that we can prevent teenage pregnancy, but once we do have a client who does become pregnant while she's a teenager, it's really to educate that young woman in terms of what she needs to be looking out for, and also hopefully her family or her social support systems, to really kind of educate them and raise awareness about some of the symptoms that she may be experiencing. So the DSM-5 is the diagnostic manual that we look to when we're making diagnoses. And postpartum depression is what most people understand it to be. You know, that's what you hear mostly. But the actual diagnosis is called major depressive disorder with postpartum onset. So major depressive disorder can have, anybody can have that, right? Men, women, anybody can have it. If you have a postpartum onset, primarily it means that the symptoms began after you delivered a baby. So once that delivery happened, typically between 4 and 6 weeks after the birth of that baby, you started to experience symptoms. There's also what's called a peripartum onset, which means that the first depressive episode or the first symptoms began during pregnancy, which is a relatively new concept within, I guess, how we look at depression and how we treat depression.
Okay.
And there is even some controversy around how postpartum depression is diagnosed, because many times young women don't even recognize the symptoms until after the 4 to 6 weeks have passed. And quite frankly, it's still postpartum depression. And for all intents and purposes, we have to remember that the treatment for postpartum depression is the same as if it were major depressive disorder. So in terms of our screening process and our interventions, and hopefully, I mean, we really look at it from a preventative standpoint in addition to the intervention, but it's really to educate the community that major depressive disorder actually affects many people, men, women, children, older adults, and yet the teenage population who is either pregnant or just had a baby is twice as likely to be at risk for developing postpartum depression.
So with postpartum depression, you had mentioned a couple of things there that I would like to touch on. One is that you said at the onset typically happens 4 to 6 weeks, between 4 to 6 weeks after having a child. So if it happens in the 8th week or the 9th week, what do you call it? Is it just depression then, or?
To be honest with you, we don't pay a whole lot. I mean, from an intervention standpoint, we don't pay a whole lot of attention to that. I mean, just realistically, the treatment really should be the same. There's no real cookie cutter approach to how we treat depression anyway, or good practitioners shouldn't be treating it in this cookie cutter approach anyway. It should be individualized to the client. So when you look at it from that perspective, whether it's 6 weeks, 4 weeks, 10 weeks, I mean, we know that the stress indicators on families who have children under the age of 5, right? So anytime from 0 to 5 goes up significantly, right? And we know that men are have a much higher chance of developing depression during parenthood, during those, that 0 to 5 year old age range in their child. So we know that this stresses families. We know that that time frame can really be a period of adjustment for a lot of families. And so we want to not focus so much on the weeks or the days, but really getting people the help that they need.
Well, you just said something that I was going to wait till the end of the show to kind of talk about, but since you opened that door, when you talk about any person can have major depressive disorder. I've seen young children who have diagnosis with major depressive disorder. But you mentioned men. And so if that window of time after their spouse or their mate have a baby, is it possible that men can suffer from postpartum depression?
Well, again, from a diagnostic viewpoint, technically no. Because technically no, but from a realistic, practical standpoint, absolutely. And what we know is that approximately 4% of fathers experience depression in the first 5 years of their child's life. So they can have major depressive disorder. It may have been correlated with the birth of their child, and that may have been a trigger for some of the symptoms, but technically they wouldn't receive that postpartum diagnosis. And it really doesn't make that much of a difference, quite frankly, because it, like I said before, the treatment and the intervention strategies should be similar.
Well, that's interesting, because the things that I was reading was saying that, and they refer to it as paternal postnatal depression. And so they were saying that 1 out of 4 new dads have PPND, depression, anxiety, and other problems with mood can occur anytime during the first year after that child is born. But you're saying from a diagnostic standpoint?
Okay, what you're saying is absolutely true.
Okay.
But from a strictly scientific diagnostic standpoint, they would not meet the criteria for the diagnosis based on the manuals that we need to use.
Which is the DSM-4.
Right,
Five.
the DSM-5.
Five.
Yeah,
Five.
But you're right. I mean, is this something that does affect families? Absolutely. And, people will use different names for different things. But quite frankly, if you take that quote that you just gave us and you look at the symptoms that those fathers are having symptoms that fall into the category of major depressive disorder or, anxiety disorders, right? So there are other diagnoses that encompass those symptoms that you're describing.
Okay. Well, what we're going to do, we're going to take a break on Fresh Start today. And when we come back, we're going to talk about some of those symptoms that you talked about. What are some of the symptoms that are related to postpartum depression and some of the risk factors? So when we return after this break, if you'd like to be a part of this conversation, please call 414-444-5250, 414-444-5250.
Did you know that Black children represent 67% of our local foster care community, according to the Department of Children and Families' most recent annual report? Many of these children are not only removed from their parents and siblings, but are placed in families, schools, and neighborhoods that do not reflect or honor their race, culture, or heritage. I was talking to some children who are in foster care the other day, and they said this traumatic experience often leaves them feeling sad, scared, and lonely. Black children and youth do matter. You can help the most vulnerable population of children in our community by becoming a licensed, culturally responsible foster parent with Fresh Start Family Services. To join our foster family, you must be 21 years of age, have a stable income, married or single, clear several background checks, complete 36 hours of pre-licensing training, and have a loving heart. To learn more about other qualifications, call 414-351-1100. That's 414-351-1100. Foster the future. Foster a child.
Good afternoon. You're tuned in to Fresh Start today. Your host is Sean Roby and myself, Jermaine Reed, and we have a special guest in the studio from Lifestriders, Inc., Veronica Sosa, and we're talking about understanding the postpartum depression in teenage mothers, and you're just talking about exactly what postpartum depression is, but let's talk about some of those symptoms, risk factors and symptoms, because there's a lot of folk just when you talk about depression alone who are not even aware that they are dealing with depression. How would a mother or a teenager know, or a group home staff person or caregiver know whether or not an individual is suffering from postpartum depression?
So, one thing I like to start off saying is that it doesn't always look the same in everybody.
Okay.
Right? Mm-hmm. But here are some typical symptoms that we associate with the condition. And it's really a low or sad mood that doesn't go away.
Okay.
It's loss of interest in fun activities. You might see some social withdrawal, like they don't want to participate. They want to kind of hole up in their room, or
the isolation.
That isolation. And, it's interesting because I think nowadays with the phone phenomenon going on, craze that we have with our teens where they're always on their phones, a lot of parents really don't, or caregivers don't really notice, right? Because kids that aren't depressed are on their phones with stoic faces. You know what I mean? So now
it's more masked.
It's more masked by their phone use. Wow. So it's not as easy to see that sometimes in your teens, especially if they were big phone users and texting or on social media or things like that. But you might even notice the things that they're reading might be different. Their posts on social media might be a little bit different. They may have a different tone to them. Right?
Or even the conversations that kind of ties into being physically withdrawn, but then even verbally withdrawn, like very short answers, things like that, a lot of fatigue, difficulty concentrating.
Exactly. And that's a big piece of
So you got a variety of things.
And even difficulty in making good decisions and choices,
Right.
Particularly if they were previously made a lot of good decisions, and so now everything is more extreme as opposed to where they used to be.
Exactly. And we see, changes in eating, sleep, and energy. And that's a big issue, right? I mean, we know that there's significant sleep disturbances associated with postpartum depression in general. But then the reality of having a baby, I mean, you're not sleeping very much. You're not sleeping like you used to. So your
Sleep deprivation,
cortisol, those cortisol levels are changing. And cortisol is your stress hormone, right? And so you need to have consistent sleep to help regulate just that one hormone alone. We also know that, like you guys had mentioned before, difficulty in concentrating, problems in thinking, making decisions. But overall, one of the things I like to tell people is you need to be in touch with yourself, right? And something doesn't feel right. You may not be able to put your finger on it. You may not know how to verbalize exactly what you're feeling, but you know that something's not right.
So what conversation should we, if my daughter's pregnant right now, my granddaughter's pregnant, or I have this foster child in my home and they're expecting a group home resident, how do I help them notice and recognize their body, their rhythm, you know, so that, you know?
Yeah, I mean, that's a great question. I think that hopefully as parents and as caregivers, we're teaching our children how to really advocate for themselves and their overall health. And self-care is such an important piece to growing up. I mean, regardless of whether you're pregnant or not, right? Like, we want to be instilling in our young children and young adults the importance of self-care and self-advocacy, right? Like, what do you do if you notice that something isn't right? Who do you talk to? Who are those people in your life that you should be communicating with, even if you don't know exactly what to say, or you're embarrassed or too afraid to talk about something? You should be able to identify. And I think parents and grandparents and caregivers can really help the child identify those people, just so that you know just so that those teens know who their point people are, right?
Absolutely.
And you don't have to give me you can say to them, you don't have to give me details, right? But if something just doesn't feel right, you come to me and I will get you the help that you need.
Or if that child doesn't have they're not able to articulate it, write it down, because sometimes, particularly girls, they are great journalists, and they can post some stuff that is very prolific. So even if you need to write it down and then give it to somebody.
And you know what's interesting too, I think it's also about educating the friends and the social network that teen has, because sometimes we see teens not talking to parents or, you know, healthy adults in their life, but they are posting things on social media or tweeting something or making comments, and there are friends who know that something's not right.
Exactly.
And those friends need to know who to talk to, right? Like, what to do with that information. So we're going to talk a little bit more about that. I really want to get into that social networking piece in a little bit. But, you know, there's some other things too that I just want to touch on in terms of symptoms. There's feelings of worthlessness or shame or guilt. And especially if it's a postpartum onset, these young moms will often feel like they knew it was going to be hard. It's like cognitively, they knew this was going to be hard, but suddenly they feel like they're just not good at this. The baby doesn't like them. They may not feel bonded to that baby, which is normal in the beginning. You know, it's very typical for moms to feel that way in the beginning, but it just doesn't feel right to them. And sometimes they just feel like they're just not themselves, and they start having unwanted and unusual thoughts that just don't go away. And that, I think, is key. I think
thoughts that won't go away. So this is a little different than baby blues.
Absolutely.
Because baby blues last up to 2 weeks after delivery, and that's what are those feelings? Because we've never, none of us guys in here have ever had a baby, you know, physically. So what are those feelings?
Well, you haven't had a baby physically, but if you're a dad, you may have had these feelings. I mean, it's this feeling of like, oh my goodness, the reality of it all starts to hit you.
Overwhelmness.
You're tired. You may not be able to concentrate. You know, you might have a lot. So dads and new moms may have a lot of the symptoms of baby blues, which look very much like symptoms of postpartum depression. But here's the difference. Baby blues tend to go away with reassuring, you know, comments. Like, you may be having a rough moment, but your mom or your husband or your boyfriend or your significant other comes and reassures you, and you start to feel a little bit better. And, you know, maybe tomorrow you might have another down moment or two, but you're able to kind of pick yourself up and keep putting one foot in front of the other. With postpartum depression, it's not like that. It's consistent, and it's most of the time. Like, the person is feeling any combination of these symptoms for more often than not. Let's just put it that way, right? And it's lasting longer. It's going on for longer. And the key to it also is those unwanted and unusual thoughts that don't go away.
Well,
and oftentimes people are very embarrassed about having these thoughts because they feel like they're losing their mind, or they feel like people are going to think they're crazy, or they're afraid of saying something because their child might get taken away from them. You know, they have these fears and ideas that prevent them from talking about what they're going through.
Now, are these fears that the adult population have, and are these fears the same that's shared with a child population or a youth population? Because I'm wondering if some of their fears or their anxieties will be coming from the same place.
Absolutely. Well, yeah. I mean, I think, again, not everybody feels exactly the same
exactly
thing.
The same, but in general.
But in general, yes, we do see that it affects both populations. I think with teenagers, though, it's a little bit different because there is so much shame oftentimes linked to a teenage
Having
pregnancy.
a baby too early,
Right.
yeah.
And there's these messages that they might be hearing from their friends or their families that, you know, it's kind of like that, you made your bed,
Okay.
right? Like,
right.
You know, having a baby is not easy, and we're not going to make it easy for you. Like, you need, I mean, to be honest with you, there are many teen moms who become homeless, who get kicked out of their houses when their families find out that they're pregnant. You know, so these are issues that are compounded by the fact that they're pregnant. So that complex social
Absolutely.
environment makes it all the more critical for them, right? Now suddenly their stressors just went up a whole lot more.
And I think along those lines, I think along those lines, when we think about teenagers, the most important group to them is their
peer
peers.
group.
And so if I'm not being accepted by my peers,
But
because
when,
it's
when
this
a lot of your
baby and
peers
now I
have
can't
babies,
go out anymore with
but
my
let's
peers.
be realistic. In some communities across the country, you have high rates or high incidence of teenage pregnancy, and people become pregnant for different reasons under different circumstances.
That's true.
So where there may have been a huge stigma or shame factor 30 years ago, 40 years ago, back in 1950, do teenagers in 1950s, and because social norms and social standards have changed, you know, you have a lot of single parent households, you know. 50 years ago, that wasn't the case. You know, divorce rate was low, and you had, you know, stable home environments where mothers and fathers were present. Now you're seeing more single parents, and you're seeing a lot of young ladies who have babies and fathers may not be involved. And your peers now, all three out of five of your peers have babies. So is that shame factor is just as intense, you know, because you see more of it.
But, you know, the messages can be very subtle.
Okay.
Shame messages don't have to be always so overt.
Okay.
Let's say, you know, and I've had a case, I'm just going to share this one story. There was a young lady who, her mom was a teen mom. She was a teen mom. And their teen pregnancy in their
Family.
neighborhood and their groups of their social network was not unheard of, right? So you would think there wouldn't be that much shame. But she experienced tremendous rejection from her friends not being able to hang out with her anymore because her parents thought that she would be a bad influence on their kids.
I see.
Right? So, you know, the parents of her best friends were not wanting their children to come, you know, their teens to come over and spend time with her because they felt they didn't want to glorify this baby, this, you know, this young woman having a baby.
Okay.
And so I don't think there was a malicious intent, but she felt ashamed. And not only was she ashamed of that and how other people saw her, but she was also very socially isolated because now her social network just shrunk significantly. The people that she was really connecting with.
Especially if those were the
emotionally.
only folks. Absolutely.
You know,
So if we can talk about the prevalence of it, and then we'll get into some of those other issues that you think are really, really critical to share with this audience. But there's a lot of research, just in general, a lot of research and information available on postpartum depression, but very little seems to focus on the specific needs of teenage mothers who are dealing with postpartum depression. I believe the research indicated that teen mothers are twice as likely to develop postpartum depression in comparison to older women, and that there are nearly three times as many teens with mental illness who get pregnant compared to adolescents without a disorder. So when we look at the prevalence, and I think it's 1 out of 8 women suffer from PPD. So when we look at how prevalent this is, we looked at some of the symptoms or the signs. What are the risk factors associated with PPD?
So we know for a fact that a previous diagnosis of a mental health disorder will put you at increased risk.
Okay.
So if you've been diagnosed with depression or bipolar disorder or any anxiety type disorder, things like that will also increase your chances of developing postpartum depression. Family, like if someone in your family has had postpartum depression, that can also be a risk factor. So we think we focus on the psychological and social risk factors, but there's also some physical risk factors that I think a lot of people don't really know about. Hypothyroidism. Okay, so people can develop underactive thyroids during or after pregnancy. And if anyone in your family has a history of an underactive thyroid or hypothyroidism, the chances of a young woman developing symptoms of postpartum depression can be very likely. So one of the things that I will often tell families is to get their thyroid levels checked. Okay, and even if your thyroid levels come back normal, a good doctor would be able to kind of get a wider panel to look at really if there is a low, like an underactive
That was interesting.
So it's not technically a hypothyroid diagnosis, but your thyroid may be off a little bit.
Well, let's look at that, because for a population of children who are in out-of-home care or in foster care, group homes, what have you, sometimes the family history is not there.
That's true.
So if there's a teenager that's in your foster home or in a group home and they've had a baby, maybe do you think it should be routine possibly that they should request a thyroid? Because again, if this parent is paying attention, then the other piece too is, we can receive a referral today that said there's this young mother, and the baby is 4 weeks old, and so I'm just now learning her, but I'm noticing like over the last week she's lethargic, her energy level, that could be possibly just adjusting to the new environment, or could this possibly be
something else?
Something else.
Here's the thing: a great medical professional or a great, I'm not a medical doctor, right? But I'm a psychotherapist. And if I had a young woman or a foster mom talk to me about a young woman experiencing some of the symptoms that you just described, I would ask that mom to talk to her doctor about getting a thyroid level, getting her vitamin D levels checked, looking at potassium and looking at magnesium. We know that low levels of some of those minerals in the body can also cause symptoms that look a lot like symptoms of low energy, lack of concentration, depression. It can actually, potassium and magnesium can actually be linked to symptoms that look a lot like anxiety. Full-blown panic attacks look like people who have a drop in potassium or magnesium as well. So we just want to make sure that we're covering those bases before because honestly, that's part of what we're going to be teaching this young woman anyway, is to advocate for her health. And when her body isn't functioning the way it needs to be functioning, what should she be doing to make sure that that she's getting the care that she needs?
That self-care, right?
That self-care piece is so important.
Because I can easily see a provider saying, okay, she's lethargic. Well, maybe it's because the baby is getting up at 1 in the morning. Caregiver, provider, yep, sorry about that. So you can see somebody easily assuming that, but it could be so much more.
Okay, but you know what? Let's stick with this particular child who's in out-of-home care, this youth, this adolescent, and not just the girl, but the foster boy or the son, the youth, the male child as well. But let's look at a history of sexual trauma, because is the history of sexual trauma, does that present a risk for that child or individual having PPD? And if so, how can that impact the care that they provide to their infant?
Yeah, so there's not a ton of research on this yet, unfortunately. And we know that sexual trauma can impact children's mental health and adolescents' mental health in ways, in very deep and very serious ways, and can have life-lasting effects, really. So yeah, I mean, I think anything that has to do with trust and bonding and being able to connect with
and
someone
breastfeeding
else is a
and
big
that
one.
is a big one. Yeah.
that attachment and attention.
I mean, if we look at reactive attachment disorder, which isn't one that it's not a diagnosis that's readily associated with putting somebody at risk for postpartum depression. That's a real risk factor because this child may never have had maternal attachments, may never had or parental attachment, and I mean, it doesn't necessarily have to be maternal,
Mom,
but
yep.
Those significant secure attachments and those that lack of maternal bond specifically has been researched, and it is known to be one of the greatest risk factors in identifying young women who might be at risk for postpartum depression.
I think to add to that, because you said that sexual abuse, but then you have just the neglect and abuse in general increases that risk factor as well.
Well, I think when you deal with children who have mental illness or even untreated mental health illness, how that impairs to some degree, or it can possibly impair that parent's ability to be responsive to their child, even if the child is crying and you just don't have the energy, you don't have the desire, to feed the child or whatever. So if this young lady was in a group home, and there's an isolation piece that as a symptom, so if we want to counter that, would someone encourage that child to feed the baby in a more common area?
That's actually one of the recommendations really that is made. First of all, breastfeeding can also be linked to so let me touch on this breastfeeding issue for a second.
Okay.
There are many women and teens who feel guilty and shame around either
Other
being
people,
unwilling to breastfeed or unable to breastfeed. And that in and of itself can cause increased feelings of shame and guilt in terms of what they're not providing for their baby. And so that's one piece, right? Then you have that isolation piece. So if they are now isolated and nobody is really seeing how they're feeding that baby, right? I mean, if you breastfeed, as a woman, if you breastfeed, the chances of you developing postpartum depression decreases.
Okay.
So it is encouraged to breastfeed because hormonally it causes a shift in hormones that will actually help to prevent postpartum depression. It peaks the oxytocin levels, which is the bonding hormone that women have right after they deliver that baby, and it's directly linked to breastfeeding, right? And that helps with bonding, and it helps to lessen the chances of postpartum depression.
Sounds great. What we're going to do, we're going to take a short break, and then we come back. Veronica from the Life Striders Incorporated will be sharing some more important information about understanding postpartum depression in teenage mothers. You're listening to Fresh Start Today.
Do you know what Nelson Mandela, Andrew Jackson, Malcolm X, and Steve Jobs have in common? Each of these individuals were world leaders who were once in foster care. We often hear about the road from foster care to prison, but did you know there's another road from foster care to a world stage? Fresh Start Family Services is looking for adults to become licensed foster parents. Every child needs a caring adult in their lives. Wouldn't it be great if you could foster or adopt the next world leader? For more information on how you can become licensed with Fresh Start, please call 414-351-1100. That is 351-1100.
You're listening to Fresh Start Today on WNOV 860 AM, The Voice. I am your host, Jermaine Reed, with Sean Roby, and our special guest is Veronica Sosa from Life Striders, Inc., and we're talking about understanding postpartum depression in teenagers. So far, we've learned about what postpartum depression is. We've learned about some of the risk and the symptoms of postpartum, how prevalent postpartum depression is in women and in teenagers, but we also understand that postpartum depression or just having a baby can impact everybody in the family.
Yes.
But now we're going to talk about how is postpartum treated. If somebody is thinking that they may have some of these symptoms that we've talked about, what should we do, or what should they do?
Well, the first thing I recommend is that you contact a mental health professional that really is prepared to handle working with teens and has some experience working with postpartum depression.
But you don't have a lot of those. I was just reading an article. Where's this organization? I'll call the organization in a minute, but
you're right.
There's not a lot.
There's not a lot. At Life Striders, we do have specialized staff that is trained to work with teenagers, and we're all very competent in being able to identify risk factors associated with postpartum depression.
Is there a number for Life Striders?
Yes, our number is 262-565-6124. 262-565-6124, and our website is www.lifestriders.org.
Right. It was the Wisconsin Association of Perinatal Care. They indicated there's not a lot of specialists in Wisconsin, and maybe that's even a national scale that really specialize in what we're talking about today. But go ahead. So,
so not only do you want to reach out to a mental health professional that's specialized in this, because they're really going to give the family a good, solid, hopefully a good, solid psychoeducational approach to helping this teen. This is one of those situations that we can't expect a magic pill is going to solve this problem, right?
Okay.
So we really want the family to be involved and understand what an amazingly important role they have. We also will encourage families to seek medical help as well, right? So if you don't already have a relationship with a pediatrician or a gynecologist, that you start to establish one or make an appointment to get in to see one as soon as possible. Obviously, if anyone doesn't feel that they can keep themselves or their baby safe, they need to call 911 immediately, right?
Okay.
You don't want to leave somebody that you suspect is in crisis alone. You don't want to leave them alone with their baby.
Because
either.
that thought of harming themselves or that
their
baby could possibly
can go up. And not only
Absolutely.
that, it could be also in the form of neglect, right? So it could be a number of different things, but you just don't be alone. Don't leave another person alone if they're in crisis, and really just call 911 and say this: I cannot keep myself or my baby safe. That's all you have to say.
And you said that you mentioned the phrase magic pill, because they do in some instances a physician may prescribe Prozac, Zoloft, I think it's Paxil, those different medications for PPD. But again, a pill is not a cure-all. It's that holistic approach when you talk about supportive family members and counselors and everybody else.
Psychotherapy and
I mean, we at Lifestriders, we take a very integrative approach to how we care for all of our clients. I mean, we really are looking at nutrition, exercise, the role of physical self-care.
What insurances do you take?
We take, we're in network with Anthem Blue Cross Blue Shield. We work with Title 19, Children's Community Health Plan. We're a nonprofit organization, so we really don't. We want our services to be accessible. Don't worry so much about the insurance piece. Call us because we have sliding scale fees if insurance doesn't cover.
Which is really important. And especially when you talk about that 4 to 6, because I was reading something about Badger Care Plus, and you know that the benefits look different after a certain time period. So if women or girls typically may have an onset of PPD, 4 to 6 months, and let's just say it's in the 8th month that they have something, will their benefits cover those services?
I don't know.
Right.
And we don't. Honestly, I don't know.
That's why the sliding
we need to look.
Other options.
Every case is different, and but we do have that sliding scale fee option for families to make sure that it is accessible for families.
Sounds great. So there's some other things that you want to share with us. I want to make sure that we are able to get this critical information out to the audience.
So one of the things that we know for sure is that when teen girls are exposed to group therapy or any kind of therapy where they're in contact with a licensed mental health professional who's helping them make sense of this, all the changes that they're going through, the feelings that they're experiencing, we can actually decrease the chances of them developing postpartum depression or peripartum depression by over 86%.
Wow.
Okay, I mean, that's significant,
that really
right?
is.
So just getting them into a group or into counseling can have a tremendous impact, okay?
That makes sense.
It does.
Because a sense of camaraderie, and I'm not alone. I'm not the only person going through this.
But I don't even think it's just it's group activity, and that could be a number of group activities. Where it's not just group therapy, but just the socialization has a therapeutic element to it.
Right.
Okay.
However, you're right about that. Except I like it when there's a trained mental health provider checking in with that kid on a weekly or biweekly basis to make sure that they're looking for those signs
Right.
that we might be missing if she was going to, a youth group or some other recreational activity, right? So that's one thing. We want to make sure that they have access to medical health care, because doctors, their pediatricians may be picking up on signs or symptoms too.
Right.
So just making sure that they have access, it's incredible how many teens we talk to don't know what counselors are supposed to do. They don't know that you can talk to your doctor about what you're feeling.
Right.
They think that you can only talk to your doctor about
my cough,
your symptoms related to your body. They don't know that they can have those conversations. We teach them that.
Okay.
Right? We teach them how to advocate for themselves, how to care for themselves, have to have a very integrative approach to self-care that's really focusing on nutrition, sleep, self-care.
Is there a parental engagement piece there?
There is, and that's what we teach under our social self-care, is really how to connect with healthy adults. And it may not always be parents, unfortunately, right? But connecting with family, friends, having healthy friendships in your life, right? And social connections can come in many different forms. Even your therapist might be your who you're talking to on a weekly basis, right? Is just having that connection with somebody where you can really be yourself and talk very openly about some of the things that you're experiencing.
I think to add to that, particularly for caregivers, if you're noticing all of these things, help this child, point them in the right direction. It's like, hey, maybe you want to consider.
But that's why I was asking about the parental
engagement.
Because if the child, let's just say, if my foster son or if I own a group home and this child is being sent to therapy, how do I know as a staff person at the group home, as a foster parent, how to best support this
That is a
youth?
Great question, because oftentimes parents or caregivers don't have real contact with the mental health professional. We do a family systems approach, which means we might work individually with that child, but we're also working with the family. And so we're kind of bridging that gap between what we're really understanding what the child's needs are and tailoring something for that family that can help that caregiver or help that parent figure out how to best support their child. And we really want to stress on, having awareness of symptoms, compassion, kindness, communication. We want to encourage those support networks. Those social supports is a really big thing. It's so important for parents to, and I think it's a really difficult decision for a lot of parents, because they don't want to send the message to their teen that they can go out and not take care of their child. But if you were an older mom, let's say you were a mom in your 20s or 30s, and you were feeling socially isolated, you could have play dates with other moms, and you could go to coffee groups, and there's all of these things in place for, older moms to go and have access to other women who are having similar type experiences as you. Whereas these teens don't have that. And if the parents aren't open to giving them those social contacts, it really hurts that teen, because they need those social supports. It's crucial to their well-being to have social support.
Not just to their well-being, but to the well-being of the baby, the infant as well,
and the family.
Yeah, and
absolutely, because it helps build trust too. Okay, you should go out and kind of relax and be with your friends and come home, whether it's mom or dad.
Yeah, or
just so they
let
can
your
get
friends
away.
come over and spend some time with you here, and make the home an inviting place where this teen can have their friends over.
Right.
While they're taking care of the baby, or, come over and visit 2 or 3 times a week for a short amount of time. There's little things that parents can do to really help support that. And another really important thing is goal setting. And that's something that we work very directly with the parents or the caregivers and the teen to set some goals for themselves. Because I think that can be, you'll hear teens say things like, you can't get pregnant because if you do, your life is over. Well, your life is not over, right?
Right.
I mean, and we will sometimes hear parents say things like that. Don't you go get pregnant because, you're not going to have a life. Well, the truth of the matter is that this teen does need to have a life. And let's set some goals.
Life goes on,
right? We need to set some life goals that the parents or their support system is going to encourage them to achieve, whether it's finishing high school or going to college or, whatever that looks like for them.
I'm thinking about the young teenage mother who's in foster care and she just had this baby, and for whatever reason she's placed in one environment and the child is placed in a different home.
Yeah.
Can that create some elevated stress and anxiety, which
Absolutely.
could possibly trigger
Absolutely.
Yeah.
I mean, separation from your baby can be devastating for for any mom.
Any mom, right?
Any mom.
For
I
any
mean, your body feels it. I had a child 7 years ago, and I remember the feeling of, like if I was in another room and I would hear him cry, like my body would have a reaction. Like I could feel it in my, it was a very visceral response that I was having. It's like, it was borderline like instinctual. And, so to expect these young women to not have that physical and emotional reaction when they're separated from their babies is also, it's not realistic, right? And it's something that we really need to address with so much compassion, I think, right? And understanding, because they may not be showing it either, that they're suffering.
Because some of them, like we said earlier, don't know. The young girls don't know, the young boys don't know, adult women, adult men. A lot of us just don't know when we're depressed or that we're dealing with something that is clinical.
Right.
So,
or anxiety. Anxiety can be some of the first symptoms that are manifested even before symptoms of depression surface. So, and a lot of kids who've never had anxiety before, they don't even know what is happening to their bodies. They think they're sick because they're having palpitations or shallow breathing. Or
I'm just wondering, and maybe you can help me with this. I'm thinking about the teenage mother who just had a baby, let's just say 2 weeks ago, and the season is changing. Can seasons affect or trigger PPD? I'm just trying to put all this together.
Absolutely. I'm kind of laughing as you're saying this, because when I had my son, it was the middle of winter during a horrible snowstorm, and we were like snowed in, and it was the swine flu season, no less, right? So none of our friends could come over because they had kids, and I was so protective of my little newborn infant, and I didn't want him to get the swine flu, right? And so I was holed up in my house for like a month, and I remember I thought I was going to take a lot of time off from work because I wanted to be with a baby. And quite frankly, like 3 weeks later, I was like, I need to go to work. Like, I need to get out of the house. I need to put some makeup on, put some good clothes on.
Right.
I needed to have like
a life.
And I had such an amazing support system, and I was still feeling this.
Critical, yeah.
And, Wisconsin weather can also make it, in addition to our low vitamin D levels, our vitamin D levels drop in September. For most people that live in Wisconsin, we have vitamin D level drops, and people of color are more at risk. Hispanic, African Americans, anybody has a little more melanin in their skin tends to have low vitamin D levels as soon, past September. So September through June, we really want to make sure that we're keeping ourselves.
Maybe July here, because it might never be sunny again, but.
Well, it's been a great conversation with Veronica Sosa, who's the executive director and co-founder of LifeStriders, Inc., and they're located out in Waukesha, but they serve a number of children from the Milwaukee area, and it's my understanding that you have a plan to infiltrate and to be based or to provide some services directly here in the Milwaukee area.
We would love to do that. We offer groups that we can do at different sites here in Milwaukee. Our therapists are more than happy to, come out to different sites and work with parents or families or children. So, we're definitely interested. Please contact us if you are in need of counseling services or groups. And our number is 262-565-6124. 262-565-6124, and our website is www.lifestriders.org.
Thank you all for tuning to Fresh Start today. Be well and be safe. We'll be back next week with Judge Mary Trigiano talking about the family drug treatment courts. We'll talk to you then.